Hi everyone, my name is Tiara Johnson, and today I'll be presenting on borderline personality disorder, also known as BPD. I chose this topic not only because it's important to understand, but also because I've been personally diagnosed with it, so this research was very meaningful for me to do. Here's a quick outline of what I'll be covering. We'll start with the symptoms of BPD, then talk about how common it is, that's the prevalence. After that, I'll go over the prognosis or outlook for people with borderline personality disorder and the best treatments, especially therapy. Finally, I'll share a real life case study of a public figure who has borderline personality disorder. BPD affects how you see yourself, how you relate to others, and how you manage emotions. Some of the main symptoms include a deep fear of abandonment, unstable relationships, a shaky or confused sense of identity, impulsive and risky behaviors like substance abuse or reckless driving, self harm or suicidal behavior, intense mood swings that can last for hours, feeling chronically empty, sudden anger or paranoia under stress. These symptoms can really interfere with daily life and relationships. The prevalence of borderline personality disorder. BPD, hold on, let's see. BPD affects about 1.4% of US adults, and about 75% of those diagnosed are women. But it's possible men are underdiagnosed. It usually starts showing up in late teens or early adulthood. People with a history of trauma, especially in childhood, are more likely to develop borderline personality disorder. And in psychiatric hospitals, BPD is pretty common, seen in about 20% of patients. Let's see. The therapeutic techniques of treating borderline personality disorder. The main therapy used to treat BPD is called dialectical behavior therapy, or DBT. It teaches 4 big skill sets: mindfulness to stay grounded in the moment, distress tolerance to manage crisis without self harm, emotional regulation to understand and control your emotions, interpersonal effectiveness to set boundaries and ask what you need. DPD has helped many people reduce self-harming behaviors, improve relationships, and feel more control of their emotions. There's also other helpful therapies, but are less used or less common. Mentalized based therapy, it helps patients understand their own and others' mental states. Transference focused psychotherapy explores unconscious emotions that arise in relationships. And schema focused therapy, which targets lifelong negative patterns or schemas formed during childhood. There's also medications for BPD, but there's no one medication that cures BPD. But certain medications can help with specific symptoms. Antidepressants may help with mood and anxiety. Mood stabilizers can help with impulsivity. And low-dose antipsychotics can help with anger or paranoia. These are often used alongside therapy, not instead of it. The prognosis of borderline personality disorder. Well, the good news is that BPD is treatable. It can take time, but studies show that with the right therapy, over half of people diagnosed stop meeting the full criteria of the disorder within 10 years. Challenges include managing suicidal thoughts, emotional instability, and maintaining relationships. But early diagnosis, consistent therapy, and support from others can really help. Healing is absolutely possible with borderline personality disorder. A case study I chose was Pete Davidson. He's a great example of someone living with BPD. He was diagnosed in 2017 after years of mood swings, anger episodes, and memory blackouts. Pete has talked openly about feeling misunderstood and struggling with relationships. He is now in DBT therapy and on medication. He credits therapy with helping him feel more stable and supported. his story. It helps reduce the stigma, and it shows that treatment really does work. So, in summary, BPD is a complex disorder that affects emotions, relationships, and self image. It's more common than people think, and it's often misunderstood. But with therapy, especially DBT and sometimes medication, many people recover and live fulfilling, full lives. Thank you for listening. These are the sources that I used: Mayo Clinic, the American Psychiatric Association, the National Institute of Mental Health, and FHE Health for Pete Davidson's story. All are reliable medical and mental health organizations. Thank you and have a great day.